That's an important question. A lot of people have knee pain, and common sense will tell you that if it's slight ache, slight niggle, most of us would want to walk it through. We want to see how it goes. A minor twisting injury or just aches and pains when you do something strenuous. Like, let's say you've been on a walking holiday, you come back and your knee hurts. Anything like that, most of us would want to wait and watch to begin with. However, the hallmarks for any serious knee pain would be if it continues for more than a few weeks, or if it is stopping you or affecting your day-to-day activities, for example, sports, fell walking, cycling, etc. So if it is affecting your hobbies, your day-to-day activities, or your work, I would suggest that's when we should consider it seriously and get it looked at. So with regards to analysis of a knee pain, the most important first step is a detailed history from a clinician, which could be a sports therapist or a physiotherapist or your own general practitioner to begin with. Ideally, if a knee surgeon can assess you directly, that's even better. So a detailed history to identify how long the pain has been, where the pain is, what sort of pain do you get, and what activities trigger it. That's a good starting point. Followed by a focused clinical examination of the knee joint. That is important to check for structures inside your knee. For example, your ligaments, your cartilage, which is called the menisci or the shock absorbers in the knee joint. So it's important to examine these and then localize that inside your knee and correlate that with your symptoms and your examination findings. Once we've done that, we can generally have a good idea of what provisional diagnosis we are looking at for your knee pain. And then this is often supplemented by further tests. And that generally starts with a standard weight-bearing X-ray of your knee joint to look for any wear and tear, etc. And then this can be complemented by other tests like MRI scan. So MRI scan is a magnetic resonance imaging scan, and that is very good at looking at other structures in the knee joint, like the menisci, the ligaments, tendons, etc. And generally from this combination of examination and imaging studies, we can have a good idea of what we're dealing with. Okay, so in terms of knee injuries, generally most meniscal tears, as in the cartilage tears, require surgery because the cartilage tear unfortunately never heals itself. So unless if it's a very small tear, which may not give you enough symptoms, most of the other cartilage tears, when it's big enough, it will be bad enough to affect your life, and therefore they require surgery. The other injuries often include ligament injuries like ACL or a cruciate ligament. That is one of the strongest ligaments in your body. So if somebody has sustained a high-grade tear of your ACL or a complete tear, it unfortunately causes your knee to become unstable. And therefore, these patients often require surgery to rebuild or reconstruct the ACL in order to regain the strength. And then often it's a combination of meniscal and ligamentous injuries. Again, they often require surgery. Now, equally though, there could be smaller things like just bone bruising, soft tissue bruising, or bruising or spraining of the ligaments. These are often managed conservatively. By that we mean physiotherapy, wait and watch, rest, ice elevation, anti-inflammatories, splint, etc. So these can often be used to begin with, and when things do not settle down, you may require surgery. Chronic knee pain often by definition means that unfortunately somebody, as in a patient or you, have suffered for long enough from that. That to me itself means that a good starting point would be a thorough assessment of the knee by an appropriate clinician, as we just discussed. Generally, by that stage, the imaging studies are likely to show an objective problem inside the knee. And this could be a chronic meniscal tear or an established arthritis or wear and tear in the knee joint. So in my practice, when I see somebody with chronic knee pain, almost always we find an appropriate pathology that is responsible for that pain, and hence surgery is likely to help in most cases. A stopgap procedure can often be knee injections. So patients I often find have, let's say, moderate wear and tear or moderate arthritis in the knee joint, responsible for chronic pain, but equally on x-rays, and we find that the arthritis is not very severe yet, and equally your symptoms may not be as bad as expected. So therefore, a knee injection, either with corticosteroid or lubricant, can often help to alleviate the symptoms as a stopgap procedure. So when we often see patients with, let's say, mild to moderate arthritis in the knee joint, as I was just mentioning before, that can be responsible for knee pain. In such cases, there are braces that are available. We call them as unloader braces. So these can be provided by a specialist therapist in conjunction with a knee specialist. And these can be adapted to patient-specific needs. And these can often be a good complement to help reduce your pain. And apart from that, some guided physiotherapy, hydrotherapy, acupuncture, other things have been tried as well. One other important factor to look out for is for a specialist to check your hip out as well, because the nerve that supplies the hip goes down and supplies your knee as well. So it is important that if you've had your knee assessed, if you've had it treated with lots of other things, but is not improving, it is important that your hip joint is assessed clinically. X-rays may be required as well, and to make sure that the hip joint is normal and it's not just the knee that everybody is focusing on. I think that actually is the most important question in my opinion, because then either we prevent any knee problems in the first place, or it's been corrected by surgery and we try and prevent it happening again. I think that is extremely important part of patient education for all of us, really. So I think first of all, a few important factors are managing your activity level. So a lot of us will stay fit by doing activities, and that could involve running, walking, cycling, fell walking, etc. The important thing here is to try and impact any repetitive loading exercises. For example, running on a hard surface, running on uneven surfaces, etc. Instead, if you can take up any non-weight-bearing exercises like swimming, cycling, brisk walking, it will cause a lot less impact on your knees and prevent further knee pain. And the second important factor is diet and weight. So if you can manage your weight in relation to your height and have a body mass index which is within the recommended standards, you will find that the impact on your knee is controlled in the long term and preventing further injuries and further knee pain.